Thank you. Thank you. I have not been doing ME/CFS for very long. When I started at NIH with this, I knew absolutely nothing. And it took me a while to learn. And now I am very happy to be here today and to be involved previously and to continue my involvement with looking at ME/CFS. So thank you very much for letting me come and talk to you today. I appreciate the invitation, and I hope you will get out of this what you need to know. And of course, you can ask me questions after. So let me get the right direction here. There we go. Let me first start by telling you that the Pathways to Prevention program is a collaboration. This is a collaboration between the National Institutes of Health, Office of Disease Prevention, and the Trans NIH ME/CFS Research Working Group. They are the ones who submitted the proposal to the ODP, Office of Disease Prevention, for the Pathways to Prevention program. As you can see from the slide, the goals of the program are fairly straightforward: identify research gaps and methodology problems, identify weaknesses in a scientific area, suggest research needs, and move the field forward through unbiased and evidence-based assessments of a complex health issue and public health issue. The Office of Disease Prevention does all of this with a very, very high level of coordination. They provide infrastructure, they provide funding, and they provide leadership to the staff at NIH who submit these proposals and review them and approve them to move on. So the Pathways to Prevention program really is a program for any disease, any illness, any syndrome, anything that needs work, that needs an understanding, that needs a more in-depth understanding of where the field is at. Remember, NIH is a research organization. We do research. Our whole goal is research, all right? It's research that will eventually move into, hopefully, translation and clinical care. It has a projection to do that. That's why we do it. But really, we serve the community of researchers in order to make sure that the research is done well. So the Pathways to Prevention program applies to any illness. Myalgic encephalomyelitis, chronic fatigue syndrome was chosen. It's a competitive process, and we were chosen to move forward. The timeline that you see here applies, again, to all diseases, all conditions, all syndromes that are being considered under the Pathways to Prevention program. So the timeline's similar, all right? And it's very straightforward. I'm going to go through each one of these phases of the timeline, so don't worry if you don't see it all here. Just to give you an idea of what our dates are like, okay, where are we on this pathway? Here we go. Okay, so if you look on the very far left, we started this process in June of 2012. Right, we've been going at this for a long time, but we started this process in June of 2012 when we first met with the Office of Disease Prevention, and we decided, hey, you know, there's a real problem here. We need to do something. The ODP received our proposal in November. They made a decision to accept it in December of 2012. We had an organizational meeting in February of 2013. It's a year ago now. Then the dark day in October of 2013, when we were supposed to have our first working group meeting to plan the workshop. And what happened? But we were all staying at home. All federal employees stayed at home. In my opinion, it was a dark day, but we got over it. Now, what that did, though, was it set us back in time, okay? So we couldn't have our working group meeting that plans the workshop until January of 2014. So we just had it earlier this month, all right? And then you'll see the tentative, okay? Let me repeat, tentative date for the workshop is December of 2014. That's what we're gearing up for, and that's where we hope to be eventually. So again, here are these dates just to give you an idea. We meet to discuss what was called the Evidence-Based Methodology Workshop, now referred to as Pathways to Prevention Program. Essentially the same program. It has the same goals, has the same timelines. It's just now called Pathways to Prevention, and I will continue now, from now on, to refer to it as Pathways to Prevention. The working group submits a proposal gets approved. The organizational meeting is a place where federal partners get together and they review the proposal for merit. Should it move forward? So February 2013, picture this. We're all sitting in a room. These are federal partners, okay? The working group, the Trans-NIH MECFS Research Working Group is the NIH representative. The Agency for Healthcare Research Quality was there. Office of Assistant Secretary for Health was there. U.S. Food and Drug Administration had a representative there, and other federal partners. These are federal partners who have an interest in investment in MECFS research. Many of them also sit on the Chronic Fatigue Syndrome Advisory Committee, and many of them are involved in the background with MECFS, especially the working group members at NIH, who don't come to stand in front of you to talk about what they do. They don't tell you how much and how hard they work to make sure that the research in this area gets completed, gets funded, is overseen, and the results get published. So the federal partners are asked at this organizational meeting, make the case. Why MECFS? Why now? And what effect will this workshop process have on the research moving forward? It wasn't hard to make the case, okay? Necessity. Affected individuals have something wrong with them. Doesn't matter what you call it, but they have something wrong. There's a common theme there. There's a lack of diagnostic indicators. There's a lack of understanding about the scope and the range. A lack of physician recognition of the problem, okay? There's an urgency. There is no FDA-approved treatment. There's no cure. There are very, very few drugs in the pipeline under development, and there are very few drugs that are in trial phase. The current interventions that are used do not treat the illness. They address the symptoms. They're not heading towards a cure. This is a public health issue, okay? People are sick. There's an unmet medical need. There was not any problem at all making the case to move this forward. So the next phase of this is a working group meeting. What the working group does in this process, the working group is composed of experts, content experts in MECFS, some federal partners, patient advocates, caregivers, researchers, clinicians, people who have an understanding of the illness. They've been involved in the illness for a long time, whether they have it, whether they do research on it, or whether they are a clinician who provides care. There were 3 major tasks associated with this meeting. And believe me, the Office of Disease Prevention ran the meeting, and they kept us on task, on time. We had a very, very productive meeting. So we had 3 tasks. Refine the questions for the evidence review. The evidence review is performed by an evidence-based practice center. Evidence-based practice center is a contract, and that contract is done through AHRQ, Agency for Health Care Research Quality. It's done through AHRQ, okay? We had to develop the workshop agenda, and that's topic, speakers, format. All agendas, topic, speakers, format. And we had to nominate panel members. I'll get to this in a minute. All right. So we had to refine the questions. Here I've listed in bullet points just the 5 major categories of questions. I do have some breakout of those, and when I'm finished with this, I can go over that breakout so you get a better idea of what we mean. But essentially, how do ME and CFS differ? Do they differ? What tools and measurements help define subsets in what could be a spectrum of ME/CFS? What are the characteristics of individuals who respond to certain treatments in the spectrum of the disorder? What does research on ME/CFS tell us about the clinical diagnosis of ME/CFS? How is it related? And have previous research findings really shaped clinical practice? Or are research and clinical practice completely separate with respect to this illness? So again, these are just the basic questions that we started with. We had to take those questions and refine them. We did refine them down. The reason we have to refine them, because the questions form the basis of the agenda for the workshop. So topic, speakers, and format for a workshop agenda. The topics for the agenda are defined by the questions that I just articulated to you and how they are refined by that working group membership. The speakers who will come to the meeting to talk about those questions are content experts, okay? Clinicians, researchers, those who have expertise in a diagnosis and treatment or conducting clinical or experimental research on ME/CFS. Those are the speakers who will come there, address the questions, and who will provide an overview to the panel members. These are people who have an in-depth understanding of the illness. They represent a specific position. They could represent a pro or con position. So I think this definition is best. I don't think this definition is very good at all. But we have balance, okay? We have a balance at that workshop, so we have input from all sides. And they are recognized leaders in their field. They're recognized as opinion leaders. They're recognized as content experts in ME/CFS. Now, the Evidence-Based Practice Center, which is the contract who does the evidence review, they will also speak to how the evidence review was done. So there are specific ways, and this is a confirmed methodology, for taking the evidence that is provided in the literature and honing that down to present or to articulate in summary findings from the clinical research. So each agenda session, which is a question or a topic area, will be followed by a town hall-like question and answer, all right? So people will have the option and the ability to, at the meeting, after each session is finished, to discuss, talk, and have conversations about the presentations. And of course, the format, we're kind of limited to no more than 2 days. Each talk is no more than 20 minutes, do the math. We have enough content for a 5-day meeting. We have to cram it into 2 days. And we're trying to do that by refining the questions. And of course, time for breaks and lunch. And of course, federal meeting, no food for feds, no food for feds who come to a meeting. That's a fed meeting. So everything is always on your own. The third task at that meeting was to nominate panel members. Well, who's a panel member? What do you mean by a panel member? Okay, a panel member is a U.S. citizen, okay? They are highly recognized experts in their specific professional or public area. Okay, highly recognized experts. They are not subject matter experts in ME/CFS, right? They may be methodologists, they may be ethicists, attorneys, immunologists, clinicians, researchers, health disparities folks, public representatives. There's a whole bunch of people who can be part of the panel as long as they are not conflicted with the topic of ME/CFS. And of course, we can't have panel members who are agency or employees of the federal government. So just to give you an idea, comparison, okay? The workshop has content experts. The content experts serve to define the content area for the evidence review. They may be a speaker at the workshop. They may be a member of that working group committee. They may be a peer reviewer or technical expert panel reviewer. Well, those are people that would all have a content expert perspective on ME/CFS. They can be conflicted. They disclose that, but they may be conflicted. They may have an opinion, a bias, or they may have some pro or con position on ME/CFS. A workshop panelist is independent of ME/CFS, the topic in this case. They don't have research, they don't have publications on that specific topic, they're not a federal employee, and they cannot be conflicted financially or research or clinically. All right. So what happens next? Well, there are 3 boxes on this slide. The one on my left is one process, the one on the right is another process. They occur at the same time, okay? The one on the left, the ODP, the Office of Disease Prevention, who's coordinating this entire thing, they have all the content from the working group meeting we just held. They will set the date, they will engage the speakers for interest and availability, and they'll submit the conference approval form, and they will do a number of things related to the actual workshop. On the other side, we have the Evidence-Based Practice Center who will start the evidence review. They will take the key questions that we send them, they will cull them down and they will pull out, using the standard methodology, what types of research they will look for and what types of things they will pull from the literature to form part of that evidence review. All right? And they will create the evidence report. All right. Now, one thing I have avoided telling you about, because it's kind of awful, is that due to efficient spending policies in the federal government, we have to have every single meeting approved, all right, over a certain dollar amount, even under a certain dollar amount. We want to get together and have a coffee. Okay, not quite that bad, but it's pretty bad, all right? So this workshop counts as a conference, counts as a meeting. We have to get it approved. Technically, according to the federal government, this workshop does not exist yet, all right? So that's why there's a big blue arrow that says approval. We must obtain approval for the conference before we can move forward. Once we obtain that approval, we release the workshop agenda, the speakers who will be coming to the meeting to speak on a topic, the logistics for the meeting, anything that anyone ever wanted to know about this meeting will be public. We'll release the evidence report to the panel members and to the public, and we'll widely promote the meeting. All right. So, in summary, just if you didn't get that all with all the slides. All right. The Pathways to Prevention program is a multi-step process, involves a very high level of coordination. Topics are submitted to the Office of Disease Prevention, selected by an independent panel at the Office of Disease Prevention based on research need. Different individuals with interest in investment are involved in developing the topic, the key questions, engaging experts, and creating the foundation content for the workshop. Foundation content consists of an evidence report, and it's based on key questions that are relevant to the field, and the presentations from the content experts. An independent panel of individuals who are recognized experts in their own field will assess the weight of the evidence from the report and from the speakers, what they present at the meeting. The deliverable from this workshop is a set of recommendations from the panel based on the totality of the evidence that they have read and heard. And a follow-up is conducted within 1 to 9 months that then works on how to process the recommendations and move them forward into practice. I want to encourage you to reach out to these people. Paris Watson is the person who is in charge of the Pathways to Prevention program. She was glad to answer your questions, and if she can't answer them, she will forward them to someone else. You may reach out to me. I'm Susan Maier. And you may reach out to Dr. Mariella Shirley. Dr. Shirley is the new chair of the Trans NIH Myalgic Encephalomyelitis Chronic Fatigue Syndrome Research Working Group. She's also the new ex officio member representing NIH at the Chronic Fatigue Syndrome Advisory Committee.
Thank you so much for your presentation. I notice people taking pictures of slides. We actually will be posting these presentations on the website, so feel free to do that, but they'll also be available to you later. Ted and then Lily.